Thank you. Once again, I thank you for coming to this press conference. As you know, it has been a week since phase 2, the start of phase 2. While the number of cases in the community remain low, we have to stay vigilant because the challenge is not over yet. As more activities resume, in fact, and the frequency of close contacts will rise, we expect the number of cases to go up, probably 1 or 2 weeks after the initial opening of phase 2. We must therefore get ready to quickly detect and isolate these cases to prevent large clusters from forming. To do so, we will strategically test more as we ramp up our testing capacity so that we can pick up cases faster. We have been testing more extensively among key population groups in the community. Let me just give you a few examples. We now test all close contacts of confirmed COVID-19 cases at the start and at the end of their quarantine period, regardless whether they have symptoms or not. This is part of active case finding. It also means that we are able to detect cases even if they have no symptoms, even if they are asymptomatic. We also test for surveillance purposes, especially those who are vulnerable or have a higher risk of exposure to COVID-19. These include residents and staff of nursing homes, preschool staff, and those returning to work in some essential services sector. As we begin to reopen our borders, we will also be testing incoming travelers before the end of their stay-home notice periods. In order for us to pick up COVID-19 cases among those with acute respiratory infections early, we have started to test those aged 45 years and above with ARI upon their first presentation to doctors, rather than to wait for a period of time when they have a prolonged ARI. So we are going to test them on the first day when they see the doctor with ARI symptoms. We will be extending our age criteria, not just 45 and above, but we will extend our age criteria to all individuals aged 13 and above, starting from 1st July 2020. I want to take this opportunity to thank all our healthcare partners from both the public and private sectors who have stepped forward to fight this war with us. These include more than 900 public health preparedness clinics, or PHPCs. The last 4 months, more than 450,000 patients have benefited from subsidies for treatment of respiratory infections at the PHPCs and polyclinics, with around $31 million in subsidies disbursed to date. In recognition of the role that PHPCs play in supporting the nation's effort in combating the COVID-19, despite the challenging circumstances, MOH will provide a one-off COVID-19 grant, as announced by DPM Heng earlier, totaling $10,000 to each PHPC. The grant will support PHPCs in caring for patients with respiratory symptoms and defray additional costs incurred while doing so. MOH will also provide a one-time swap and send home startup grant of $1,200 to PHPCs in the SASH program, swap and send home program, to help clinics defray their additional startup cost. MOH is committed to take good care of our healthcare professionals who are on the front line of our COVID-19 fight. We will ensure that all of them are adequately protected with personal protective equipment, or PPEs. While the risks of infection are low with proper PPE, we recognize that should the doctors get infected, or doctors of the PHPCs get infected or are quarantined, the whole clinic may be impacted, as many of these clinics are run on a solo GP basis. MOH will therefore provide an assurance grant to support PHPCs whose regular practicing GPs contract COVID-19 or are placed on quarantine order during the course of their work. Eligible PHPCs will receive $500 per day for the duration of the doctor's recovery or quarantine period. This will allow them to employ a locum or to cover the costs and the loss of revenue of the clinic while they are under quarantine or while they are ill and recovering in the hospital. We hope that these initiatives will help us reassure our GPs as they continue to take care of our COVID-19 patients. At the individual level, we can each play our part to prevent ourselves from getting infected and to keep one another safe. Let us all continue to be socially responsible, stay vigilant, and not let our guards down. Now let me say a few words in Mandarin. 第二阶段的重新开始，至今已经过了1个星期了。虽然社区的病例到目前还是维持在低水平，我们还是需要继续保持警惕。随着更多的活动恢复了，人与人之间的接触也更加的繁密，感染的危险也随之提高，所以我们必须做好准备，尽快地找出并隔离受感染的病人。因此，我们会策略性地进行更多的检测，以及更早地找出冠病的患者。检测的另一个用途是用来监测，尤其是针对弱势的群体以及有较高风险会受感染的群体。这些人就包括了疗养院的住户和职员、学前教育领域的教职人员，以及从事必要服务领域的工作人员等等。这些我们都需要进行检测。正当我们准备重新开放边境的时候，我们也会在入境者结束他们的居家通知期限之前，对他们进行检测。目前我们已经开始对所有45岁以上，在第一次看医生的时候就已经出现症状的病人进行冠病检测，而不是等到他们的病情维持了几天没有好转之后才来检测。从7月1号开始，我们会把这个检测的范围扩大到所有13岁以上的病患。我也想要借这个机会感谢所有挺身而出的一切对疫情来自公共和私人领域的医疗服务伙伴，谢谢他们支持我们的这个抗疫的行动。我们每一个人也必须尽责，采取防范的措施，保护自己，保护家人，这样我们才能够安全的继续开放，让我们的整个国家、整个社区都能够得到平安。Now let me invite Director of Medical Services, Professor Kenneth Mak, to share the update on today's medical situation. Kenneth?
Thank you very much, Minister. As of the 25th of June, 1200 hours, the Ministry of Health has preliminarily confirmed an additional 113 cases of COVID-19 infection in Singapore. The vast majority continue to be work permit holders residing in the foreign worker dormitories. Based on our investigation so far, there are 5 cases in the community, of whom 1 is a Singaporean and 4 are work pass holders. We're still working through the rest of the numbers and details. These information will be provided in the press release that comes out later tonight. Thank you.
Good evening. We are continuing with our strategy of undertaking aggressive testing and tracing to control the spread of the infection. And so far, we have been able to do so through phase 1, and now in the first week of phase 2, the situation remains stable, but we are monitoring it very carefully and remaining very vigilant. Where the migrant worker dormitories are concerned, up to now, we have about 120,000 workers who have either recovered or have been tested to be free from the virus. By the end of next month, we expect about 70 to 80% of the workers staying in the dormitories to be cleared, meaning they will have either recovered or tested to be free from the virus. So by the end of next month, we would have covered quite a large proportion of the workers in the dormitories, and shortly after that, beyond that, we would be able to completely clear all the workers and clear the dormitories, and they would be all the workers we expect would be able to resume work thereafter. So we are controlling the infection in the community, and we are continuing to make progress to clear the migrant worker clusters and the dormitories and allow the workers to resume work safely. We are now 1 week past phase 2 reopening. I think the majority of Singaporeans and residents in Singapore have cooperated with the measures. They have acted responsibly and taken all the necessary precautions even while they go about resuming their activities. Unfortunately, there are still individuals, business owners, operators, as well as individuals who have acted irresponsibly. Some are still doing so. Our safe distancing ambassadors, our enforcement officials are on the ground, deployed, checking regularly all the different places, and they will not hesitate to take anyone who breaches the rules to task. And if there are egregious cases, these will be prosecuted and charged in court. And we have made it very clear, anyone that's a first offender, there will be a fine. Beyond that, if we see any egregious cases, we will prosecute and charge them in court. And if they happen to be individuals on work passes, their work passes may be revoked. If these are businesses or offices that breach the rules, and if these are again egregious breaches, we will go in and we will shut down the operation immediately. It's a business or office, they will have to close right away. And this will impact the business, it will impact the office, and that's why it is so important for all businesses to understand that they have to take the measures seriously. This is not something that you try to minimize effort and then wait and hope that the authorities do not come and check on you. Because if you take that sort of attitude, you can be sure that at some point in time, someone will report the lapses that they see in your business premises, and we will come down and we will ask you to close. And the consequences of that closure will be much worse for any business. So it's far better for all businesses to take the measures seriously and do their utmost now to comply with the full extent of the requirements. So we seek everyone's cooperation to do this, both in businesses and individuals. Take all of the measures seriously. It requires discipline. It requires some sacrifice on the part of all of us. But collectively, if we do this, we will stand a better chance of a safe and sustainable reopening in phase 2. Thank you.
Questions from the floor?
Thank you, panelists. We'll now begin with the Q&A session. Members of the media, please remember to use the raise hand function if you would like to ask a question. Please only ask one question to allow more to participate in the Q&A. May we have the first question from Ke Yang of Zhao Bao, please?
Hi, good afternoon, ministers and Dr. Mark. The first question that I have is regarding the testing capacity. How is the testing capacity that we have now per day? So how many people we can test? And in that view, will it, because there's a lot of interpersonal contacts that may happen during the campaigning period of the upcoming general election, will the Ministry of Health be considering or making mandatory for the campaigning teams to actually be tested before the actual campaign activities happen? Thank you.
I'll ask DMS to talk about the testing criteria again. Let me just say that currently we are testing about 11,000 in total per day. This includes all the tests and different the test regime that I mentioned earlier as well. So we do about 12,000 per day. Sometimes it's higher, sometimes it's lower. Our capacity is a bit higher than that. So we have some margin, some buffer that will allow us to now move on to the ARI tests, which I mentioned earlier. We are going to move from those 45 and above to include those who are 12 years and above. And this will include the first day that you present yourself to the doctors, we will swab you and test you. So this will be a significant increase in our testing regime in detecting COVID-19. I'll ask Kenneth to add on, if any, on, as well as whether we will test candidates.
Okay. Yeah. I'll start off first by talking about our testing capabilities. Minister is correct. We've been steadily expanding the capabilities that we have. Currently, we hover somewhere between 11,000 to 12,000 on a daily basis consistently. But on certain days, that number, in fact, increases. It's gone up even up to 14,000 in a day. And this is dependent on the testing strategy imposed for the day. There are tests that are performed, as you know, as part of the medical support for the dormitories, for the migrant workers living in the dormitories, as part of the dorm clearing strategy. And depending on the block, depending on the dorm that is selected for the day, the testing numbers may change. And this also partly accounts for why the case count sometimes varies on a day-to-day basis. In addition to that, we have the regional centers that are carrying out testing in the community. And we've previously been testing for those that we deem to have a higher risk of exposure to COVID cases, as well as those who are in contact on a regular basis as part of their work with vulnerable groups of people. And we required them to be tested. Some continue to be tested on a routine basis. More recently, over the last few weeks, we've been expanding the community-based testing regime to include seniors, students and staff who work in the schools, students above the age of 12 years old, with respiratory symptoms presenting to our clinics. They would also be tested. And come July, we will continue to be expanding this. We are including, for a start, all people who present with acute respiratory symptoms above the age of 45. But by July, we are hoping then to extend that to the rest of the adult population as well. And steadily, we continue to expand the numbers of people that will be tested, both in the community as well as in the dormitories. The test strategies vary depending on the context. In the community setting, many of these tests are in fact done via pooled testing strategies in order to reap as much efficiency in our testing strategy. We could test them individually, but it makes more sense for us to be efficient in the process, and we test them using pooled strategies. There's serology testing that's also being done as part of epidemiological tracing, but also in the dormitories as part of the clearing strategies. We also are exploring different, more innovative ways of collecting samples for testing, but some of the test strategies or collection strategies we're exploring have not reached sufficient evidence to or sufficiently good results to satisfy us that they are ready for regular use in the community. So we are continuing to explore and look at these new techniques for doing testing. With regard to the second question you've asked, at this point in time, we do not require testing to be done for those who are stepping forward to campaign for elections or to stand forward as candidates. However, the candidates or those who are in fact coming forward for the elections, as well as their supporters, must obey safe distancing measures. These have been put forward already by the Elections Department, and they are designed to protect the health and safety of all members of the public, as well as those who are campaigning themselves. And we urge all who are involved in the elections to obey these rules and regulations, which are designed to protect them, their supporters, as well as the public. Thank you.
Thank you, panelists. Can we have the next question from Salma from Straits Times, please?
Hello, thank you. Mr. Gan mentioned earlier that the effect of phase 2 will probably be seen in about 2 weeks' time. The question is, well, I hope the cases in the community will not go up, but should it go up, it's just 1 week before general elections. And if the number in the community continues going up, is that going to impact on GE? And is there any infection number that will trigger reintroduction of circuit breaker measures?
Thank you. I explained this a few press conferences before. I'll repeat that again. First, I think the numbers may go up because of higher interaction and higher people-to-people contact, so there's a higher chance of transmission. So we know that currently there are underlying cases, undetected cases, what we call cryptic cases, and that's why from time to time you have unlinked cases being detected. So these are underlying cases, and with more interaction after the opening, the risk is that the number of cases will go up. And given the incubation period of between 1 to 2 weeks, therefore you are likely to see cases coming up after 1 or 2 weeks after the opening, which means next week or the week after. So there are possibility that the number of cases may start to grow. And I explained earlier that it is important for us to look at the nature of these cases. We expect that the number will go up, but we are more concerned about cases where they form a large cluster, like what we saw in Safra and the church cluster, and as well as the office clusters. And these clusters are a concern because there are a multiple number of people who are involved, who are infected. And we are also concerned about super spreading events that could have a multiplying effect. So these are the trends that we are monitoring. And we are also worried about a sudden spike of a large number of cases, even though they are not related to a cluster. So the nature of the cases is important, as important or if not more important than absolute number of cases. So we are monitoring and watching. And the response to this number of cases will also depend on the nature of the cases. And for example, if it's a cluster, it's in a very specific setting, we may introduce tighter measures in these settings after investigation and understanding the nature of the transmission. So we may not go back to the circuit breaker where we have a nationwide circuit breaker where all activities stop except essential activities. Unlikely to return to that scenario. What is more likely is to have a very targeted intervention depending on the nature of the outbreak, the nature of the infection, and whether we are able to contain it within specific setting or specific groups of people or specific nature of activities. And then it will have to depend on the actual cases when it happens. So the important thing is for us, before these cases happen, we enhance our detection capability by expanding our ARI, doing more surveillance and watching the trends more carefully. I think this will help inform us on the status of the infection in the community to allow us to react faster.
Thank you, Minister Gan. Can we have the next question from John from Reuters?
Thank you, panelists. Two questions, if you'll allow me. The first, maybe for DMS. Can you give us the official position on the use of dexamethasone in Singapore and stockpiling plans for remdesivir, given reports it can cost up to $5,000 a dose? And second, for the minister...
John, sorry, but we have to leave it there, as we only allow for one question. Panelists, please.
Well, John, I will answer your question. We have looked with interest the data and the evidence that's coming out from the UK. The evidence for dexamethasone having a positive impact on those who require oxygen support therapy and in the ICU is very promising. But beyond the news conference, we continue to wait for the formal publication of the data where more information will come out. We have an expert work group that's in fact looking at this right now, and they have published interim guidance on what to do in terms of looking after patients with COVID. They are planning to put in an addendum into the guidance document with regard to dexamethasone to guide doctors in Singapore on how it's to be used. However, I will point out that while the news from the UK is encouraging, the evidence of benefit has been particularly in the group of patients who are more seriously ill, those who require oxygen therapy and those who are in the ICU. In Singapore at this point in time, in fact, the majority of our patients have mild illness. We only have one patient in the ICU for quite some time now. And therefore, how much benefit dexamethasone will have in Singapore for the patients that we have, ultimately, it may not be that as big an impact as it is in the UK, just simply because of the case mix and the severity of infections that we're seeing in the UK as opposed to in Singapore. That said, dexamethasone is a common medication and common use in Singapore. We do have ample stock of the medication, and we're not concerned at this stage of our supplies of dexamethasone running out. You've asked also about remdesivir. It is a medication that has been made available to some of our patients in our hospitals in the context of a trial that's being done. In fact, the trial enabled Gilead to provide these medications for some of these patients in the context of those studies. Remdesivir has been recently approved by our Health Sciences Authority, and therefore now there's an ability for the drug to also be brought into Singapore beyond the study context, and we continue to work with the company on how best this medication should be used for our patients, and there's some discussions underway in terms of procurement as well. As the discussions are still underway, I'm not in a position to be able to provide further details at this stage.
Thank you, panelists. Can we have the next question from Shara from CNA, please?
Hi, good evening. So with the expansion of the criteria, the age criteria to 13 with people with ARI, how about those who may not have these symptoms? Can they go in and can they possibly request to get tested even if they don't have any of these ARI symptoms?
As I explained earlier, I think we, with the expansion of our capacity, we are able to do more testing. But even as we are doing more testing, we do so in a very strategic way, in a very targeted way, because otherwise we'll just end up testing a lot of people unnecessarily because they are not at risk, and the possibility of detecting a case will become very, very low. So it's not effective in employing our resources that way. So better for us to be quite focused, and these are people who have ARI already, the symptoms already, so it's very much more likely to detect a case. Even then, the possibility of cases being detected is already quite low because of the general low prevalence of COVID-19 cases in the community. There are cases, but generally the prevalence is low, and therefore even testing ARIs, you may not be able to pick up significant number of cases. Currently, we already have a surveillance, as I mentioned before, based on prolonged ARI symptoms. We do tests every now and then, and in fact, we test about 800 cases a day over the last few days, and we have not detected any cases yet. It doesn't mean there are no cases because these are sampling. So therefore, you need to actually sample quite a lot of samples before you are able to detect a case. And it's better for us to use our test capacity in a more targeted way so as to give us a better sense of whether there are underlying cases in the community. And for the cases that are asymptomatic, they are likely to have associated symptomatic cases that we will be able to pick up from our ARI testing anyway. So the ARI testing, other than helping us to detect the cases early and faster, it actually serves also as a surveillance to tell us that if there are X number of ARI cases being detected, they are likely to have a similar number of cases of asymptomatic cases that are not yet detected. So this gives us a sense of the overall landscape of the community infection prevailing at that point in time. So I think by focusing on ARI cases, it will already give us sufficient information. Over and above that, we are also, as I mentioned, doing surveillance testing on asymptomatic people with no symptoms at all, and these are critical workers, some of the essential workers. We mentioned that we are going to do a regular testing of some of them who are asymptomatic. This will also help to inform the MOH of the status of a community transmission. So I think some of these efforts are in place rather than to have a general, random testing of people who walk in. I think it is better for us to focus our targets of our capacity in testing. DMS?
Yeah, just to extend on and respond further to Cheryl, while we are testing in a much more extended way symptomatic people coming forward with acute respiratory illness, I will point out that we are actually already testing quite extensively asymptomatic people as well. We mentioned earlier about routine regular testing of frontline workers, those who are working in essential services, those who are working and in close contact with vulnerable groups of people in the community. The vast majority of these people subject to testing are asymptomatic. And therefore, it's not that we are not testing asymptomatic people, we are, and they do form a large proportion of those that are actually currently being tested. But this is a strategy of being more focused, such that we want to make sure that the yield that we get from the testing is much higher than just blindly testing at a discretionary basis in the community for asymptomatic people. Even in the focused group testing, we found, in fact, the percentage of people coming down with COVID-19 detected to be very low. So the yield, in fact, would be much lower, extending at this point in time wide-based community discretionary testing of asymptomatic populations. So we have not made plans to move in that direction just yet.
Thank you, panelists. Can we have the next question from Tessa from Today?
Good evening, ministers and Dr. Mark. My question is on the travel bubble. So it's really been announced that the government is working with different countries to open travel bubbles or green lanes to kind of resume travel. So I just want to find out how would the news of the second wave of viruses that are breaking out in like South Korea, for example, in Beijing, will affect these discussions with various countries when it comes to establishing these travel lanes and travel bubbles. Thank you.
We continue to assess the situation in all the countries around us, and it's a dynamic situation. So we recognize that what happens today, the situation can change. So the position continues to evolve. But so long as the broad situation in that country is under control, just because there is a flare-up of a few cases happening doesn't mean that immediately we put a stop to the travel green lane arrangements, because remember, the fast or green lane arrangements do come with their own safety protocols. It's not about unrestrained travel, right? Anyone who wants to come on that sort of arrangement, like the one we have with China now, first of all, would require to be tested multiple times, departure, arrival. They will have a controlled itinerary, and then when they go back, they will serve a quarantine. So there are quite a number of safeguards in place for the travel. And so even if there are new cases emerging in some of these places, so-called second wave, I think our broad assessment is if the situation in that country, if the infection situation in the country broadly remains under control, and the flare-up of cases is not overwhelming their hospital systems. Yes, there are new cases, but they are still able to do effective contact tracing to contain the cases and to prevent further spread. Then it's not something that would stop us from continuing with the green or fast lane arrangements that we have worked out with these countries.
Thank you, Minister Wong. Can we have the next question from Kai from Channel 8?
Hi, I would like to ask, there have been some reports showing that for some patients after they discharge, they experience side effects such as lung blood clot or cerebral infarction. So do we see a lot of these cases which develop side effects after they discharge? Thank you.
Thank you very much for that question. This is a topic that we place close attention to. The evidence internationally considering the risks associated with COVID-19 infection, even after recovery, is continuing to evolve and accumulate. I don't think many infectious disease experts, in fact, at this time would confidently say they have a complete understanding of what the risks are or the consequences that can arise in COVID-19 patients. We have, you may remember, announced previously the passing of one migrant worker who in fact collapsed after having fully recovered from COVID-19 infection and subsequently passed away. And the cause of death was certified as a massive pulmonary thromboembolism. So we do have a case where we looked at it and we recognized that this was a sequelae or complication that arose even after a recovery from an acute COVID-19 infection. So it's not a risk that only occurs in the international setting. It also is a risk that we are paying close attention to in the Singapore setting. So we're continuing to look at this, reviewing this, and determining whether there's a possibility of identifying people who are at higher risk of getting complications, and if we are able to identify them, whether or not we can do anything to lower that risk, to keep them under follow-up and under monitoring. But at this stage, the evidence for this is starting to emerge. We recognize that there is a risk of such events occurring, clotting disorders, whether they occur in the lungs, in the heart, in the brain, causing strokes. But at this stage, there's insufficient information to guide us in terms of whether every single worker, every single case that we encounter requires to be on medications, or whether or not there's a possibility we could identify high-risk individuals for which some preventive or prophylactic treatment is possible to reduce that risk. So we are looking and reviewing the data, and we are studying this very closely.
Thank you, DMS. Can we have the next question from Philip from Bloomberg?
Yeah, hi. Good to see you all. I almost feel badly asking about this, but I wonder if, given the situation, if you'll maybe perhaps consider bringing down the DORSCON level. Thanks.
You should feel bad asking about this.
As you know, had progressively stepped up our DORSCON levels until we reached DORSCON Orange, and that was on the basis of a concern about community spread. We are in a better situation now than when we first started and when we raised the DORSCON level to Orange, but we would prefer to continue to watch the situation closely before we want to bring the DORSCON level any lower than what it is now. We've only just recently moved into phase 2. We are continuing to watch very closely whether as we resume many of our services, whether in fact we would now see a resurgence of community cases occurring or clusters. So we think it's premature to rush into making a decision about lowering our DORSCON level just now. We also want to make sure that this doesn't cause a great sense of complacency among members of our public, which would then cause them to let down their guard, relax on the discipline that they actually require with regard to hand hygiene, infection control measures, wearing a mask, practicing safe distancing. De-escalating DORSCON is not the most important thing right now, but paying attention, maintaining that discipline is the most important thing that they have to do. And we will continue to watch this space, watch to see what the number of cases is like, and eventually make a decision what to do with that DORSCON level.
It's
So I just wanted to say that I wouldn't fault Philip for asking the question. I think it's a good question. My sense is that we ought not to let our guards down. The important message is that our trouble is not over yet. And you still see a number of cases in the dormitory. And therefore, we actually need to maintain our guards and maintain our vigilance. And therefore, we should maintain the DORSCON level at the orange level. And this will also allow us to raise our awareness and step up our surveillance. And as we move from phase 1 to phase 2, the sense is that we are not actually feeling safer, and therefore we can celebrate and we can relax and enjoy ourselves. But it's actually a rebalancing, because we do want our economy, our community activities to restore somewhat and progressively, and hopefully we do so safely. But at the same time, in order for us to do so, actually we need to tighten some of our regulations, our safe distancing measures, and impose more restrictions in other areas so as, on balance, to continue to maintain a safe environment. So it's not an overall reduction of risk level and vigilance, but a more balancing approach by allowing more activities to resume, by the same time tightening our measures. Say, for example, the expansion of our surveillance, our testing is actually, in a way, stepping up our vigilance in monitoring the situation. So we should not think about changing the DORSCON color yet.
I feel compelled to say something. See, Philip, the question you asked has provoked such a reaction from all of us. Because we really need to understand the fight is far from over. There is still a long way more to go. Of course, it's easy to get into this sense that we have just overcome a major wave of infection and situation is stabilizing, reopening is happening, dorms are being cleared. The sense of relief is quite palpable, and you go out, you see many people who are quite happy to be out and about and to be able to go out to their favorite places. That's very understandable. But all the countries around the world that have exited from lockdowns have been grappling with this, which is how to maintain that, allow more freedoms, allow more activities to resume, but still recognizing that the virus is not been eradicated, it's still circulating, and that need for vigilance, that need for a new normal to be in place is quite critical. So we do need everyone to understand this and change our behaviors and mindsets. And on the part of the government, what we are doing, as we have been articulating, is to step up our regime of testing and tracing. We believe that all the things that we are doing now through surveillance testing, through more aggressive testing, will help us, and also our ability to do faster activity mapping each time we see a contact. We can get that activity map put out within a day, less than a day sometimes. So all of these are capabilities that have been painstakingly built up over the past few months. They put us in a better position to control the virus, but they are no guarantee of us, they do not guarantee our ability to contain the virus 100%, right? Because you can be sure with this virus how infectious it is and the ability to spread quickly and without even symptoms. Something can flare up in a group, in an activity without our realizing it until it's down the road and many cases have formed. So that's something that constantly worries us. We are monitoring as best as we can. We are staying as vigilant as we can on the part of the public health officials and government officials, but we really urge every individual to do their part and stay vigilant and disciplined at the same time.
Thank you, panelists. Can we have the next question from Jana from TM?
Yes, hi, I'd like to ask this question. Over the past few days, the number of cases on the community has been low. Most of these cases are work pass and work permit holders who are not residing in the dorms. So where do they reside and what is their profile like? And is there any imminent possibilities of clusters forming at the places that they stay? Thank you.
Many of these workers in the community are actually staying in various quarters arranged by their employers. So these could be in various residences, actually accommodating small numbers of these workers coming together. We've looked at it and to try and discern whether there are various patterns at all. No clear trend in some of these cases, but we have noticed that, in fact, in a number of these cases, are being picked up because of our routine surveillance of these workers. They are working in the community, and because of that, to safeguard the safety and welfare of our public, we've been engaged in routine testing for many of these workers. A significant number of these workers being diagnosed, in fact, come off that testing stream. Many of them are asymptomatic, and when we test them, a number of them, in fact, show signs in their testing results that suggest that the infection may, in fact, have occurred some time back rather than a recent infection. So it may be a reflection of what we had described before, cryptic a low level of cryptic infections that have been occurring among asymptomatic people. And then we're picking them up because of our routine regular surveillance, our heightened testing regime for these workers that brings them to the fore. But at this stage, the numbers we looked at continue to be low. We are vigilant. We are careful to pick up clusters, and where we see the potential for clusters occurring, we will continue to cast a wide net to test all close contacts, to bring them all into isolation, and to disrupt any potential chains of transmission that will take place. We've done that consistently, and we'll continue to do it for this group of people to make sure that these a few cases do not now erupt into a large cluster as a result of continued uncontrolled transmission occurring among the community of workers in these residences.
And you probably noticed from our daily report that we now provide some details of each case, whether they are linked, unlinked, whether they are a result of proactive screening or not. I think you will find that over the last few days, the vast majority of the cases are actually asymptomatic cases, and they are a result of our proactive screening. And many of these cases, unless you do proactive screening, you actually would not have picked them up because they don't have symptoms and they will go about doing their work and so on normally. So therefore, these cases are picked up because we are proactively screening them one by one. Some, for example, in the preschool sector, some are the workers going back to work, so we do regular screening for them, and that's how we pick them up. So these are the cases we continue to monitor. Once we pick up a case, we determine whether they're active or non-active. If they're active cases, we do quarantines, we do contact tracing like we do for all cases. So to make sure that if there are any further infections associated with this case, we will be able to ring-fence them, quarantine them to prevent further infection. So I think this is what we do, and going forward, we will continue to do that. And as I mentioned, we are testing earlier for those with the symptomatic. Hopefully, we are able to catch the cases faster and earlier, and we can quarantine the contacts earlier to prevent further infection. So I think these are the efforts we take together to keep the infection level in the community as low as possible.
Thank you, panelists. We have time for the last 3 questions. Can we have the next question from Siti from Kyodo?
Hi, thank you very much. Okay, so my question is, just now Minister Lawrence Wong mentioned about business owners who have acted irresponsibly. I'm just wondering whether you can elaborate on that, like in terms of what are the most common offences among businesses in this phase 2 that got them into trouble, and what are these offences that you consider most serious in this phase 2? Thank you.
Well, if they are customer-facing businesses, retail and F&B, then the key requirement is for them to put in place proper safe management practices, particularly in managing the customers that patronize your stores. So if you're in F&B, you have to ensure that the diners are in groups of not more than 5 people and they are seated at least a meter apart. There should not be any live music, TV screening, anything of that sort in the premise. If you are a mall or a retail business, then you should be making sure that your the stall itself, the queue management for your customers is properly done, so that if indeed large groups of people come in to patronize the store, you have a proper queue management system and you do not end up with all of them rushing in and then being in close contact with one another. So I think these are measures that we have informed all the businesses. They understand this quite clearly. The level at which some of them do it, I think it's uneven. Some are really on top of things and they do it very well. Some can be better. And then, of course, for the ones that don't do it so well, if and when something happens, when a large crowd gathers, that's when the weaknesses in their systems show up, right? I mean, if you don't have a good system, but there are not so many people, then you don't really test the system. But if you have a weak system of controls and then you have large numbers of people coming to your store, that's when the system is under stress, and that's when all the weaknesses show up. And there are stores that have, or there are outlets that have run into problems. So over the weekend, we've had some issues with some of the F&B outlets along a road in Holland Village, and we have taken some actions there. And we are continuing to monitor whether it's F&B outlets or retail shops, and we will, as I said, be very vigilant in our enforcement actions. And if and when we see breaches happening, we will go in straight away to rectify them. If it's a minor breach, we will ask the business to do the necessary rectification actions, and then make sure that and then continue on with it, right? But if it's an egregious one, then as I said earlier, we will look at asking the business to close their operations until such time that they can put in place the proper safe management measures in place.
Thank you, Minister Wong. Can we have the next question from Yijin from Xinmin?
Hi, good evening, ministers and Dr. Mark. My question is, as general election approaches, we have seen more walkabouts in the community, especially at hawker centers and coffee shops. So actually, we would like to ask, will there be any actions taken to the party if the party breached the safe distancing measures during their walkabout? Yeah, thank you.
Thank you very much for that question. The Elections Department has issued their guidance, and MEWA and all the other agencies are continuing to watch very closely to make sure that safe distancing measures are not breached. And this is irrespective of whether the parties committing the offences are from political parties or whether there are others involved in this. We generally take an approach where we would first highlight the breaches, give advice and teach and educate people to do the right thing. But if the breaches continue despite counselling and advice is given, or if the breaches are egregious, very severe, then we will have no choice but to step in, and penalties may have to be imposed. And this is irrespective of who the people are that in fact have carried out these offences or breaches. Therefore, it's not an issue of whether or not these are political parties carrying out their walkabouts or whether they are other individuals. As long as these are breaches that are of concern, they compromise the measures that we put in place to safeguard the welfare and safety of others, and they carry a risk of spreading infection, then we will have to step in and impose any disciplinary action accordingly.
Thank you, DMS. Can we have the last question from Zhi Peng from Wanbao?
Good evening, ministers and Prof. Mark. This is Zhi Peng from Wanbao. My question is for Singaporeans living in Malaysia, how will they come back to vote on polling day since there are no overseas polling stations in Malaysia? And how many % of migrant workers staying in dormitories are yet to be tested? Thank you.
The second question, I shared the figures just now that we have 120,000 workers living in the dormitories who are either recovered, right? That means they've gone through, they've had the infection, they've recovered, or they have not been infected before, but we've tested them, put them through the isolation period, tested them again, and they are verified free from infection from the virus. That's 120,000 as of today. The total population in the dormitories is about 320,000. So that's about 40% today. And by the end of July, we are looking at, there will be a range, this is a projection, right? So we think we can get up to 80% by the end of July, right? Who are either recovered or tested free from the virus by the end of July. That remains, 20% will then remain. And hopefully, after a few more weeks beyond that, in August, we will be able to clear all of the workers in the dormitories. That's for the migrant worker situation. for elections, the situation is no different whether it's Malaysia or any other country. I'm not aware of the latest. Yeah, I mean, anyone can, so it's whether it's you're in Malaysia, whether you're in any other country, if you would like to vote and you want to vote, then come back and vote. There's no reason why you can't come back and vote, right? You may have to be subject to SHN, but even under SHN, there can be arrangements made for you to vote.